Hello, for my clinical pattern, I had thumb CNC arthritis. It's also called Rhizarthrosis. I'm pretty sure we know what osteoarthritis is at this point, but this specifically is at the thumb CMC joint. The etiology or demographics of this pathology specifically affect women more than men. 40 to 45-year-olds are more affected. That age and older anyway. The younger population normally isn't affected because it is a degenerative condition. An outcome tool that could be used is the thumb disability examination, as well as the DASH questionnaire, which can be used for a lot of upper extremity pathologies. For the examination, you're going to see on observation swelling is really likely down here. There could be thickening of the muscle and soft tissue down at the base of the thumb. You could also see a bony nodule down here depending on how progressed the disease is. Active range of motion is probably going to be limited in most directions, if not all. Passive could be limited in extension, abduction, and any kind of rotation that you choose to do. Resisted testing, there's likely weakness, and there could be decreased grip strength. Again, all of this depends on how progressed the pathology has gotten. There's likely hypomobility, and distraction is going to likely feel good to these people. Nerves really aren't involved unless they report nerve symptoms. It's going to be tender to the touch, especially if there's that bony nodule there. And then there's two special tests that are specifically for this, the grind test, which we know, and then the traction shift test, which I will probably demo in class for everybody. You have the patient in elbow flexion on the table, and then you take their hand, passively put them in ulnar deviation and extension, and then you work them toward wrist flexion and radial deviation. And you're looking for pain or any similar things to the grind test, scraping or clunking or bony sounding or bony infills during the test. Differential diagnoses include Querbian synovitis, a scaphoid fracture, trigger thumb, flexor carpi radialis tenosynovitis, and arthritis of the other joints of the hand. For diagnostic imaging, radiographs are going to be key here. The BET view is often used, and there's a very specific classification system called the Eaton classification system. It uses stages 1 to 4, so please reference the clinical pattern for this, but stage 1 is normal articular changes, and then it goes all the way to stage 4 where there's significant joint space deterioration between the scaphoid and the trapezium. For signs and symptoms indicating a referral out, you're going to have your normal red flag signs and also any signs of inflammation or infection or RA. For surgical indicators and options, again, you're probably going to want to look at the clinical pattern because there is a pretty extensive list there, but an extension osteotomy is an option, a carpometacarpal arthroscopy with debridement, a trapeziectomy, and then there's also different versions of that specific surgery, and then there's an implant arthroplasty. So several options there. So take a look at the clinical pattern.